Hey, everybody, it's David. I'm your host of Highway to Health podcast. And thank you for being here in the past, for being here today, and continuing to tune in. We try to bring you the best in healthcare. And we want to celebrate the thought leaders, the experts, the innovators. Some might even call them disruptors in our industry. And they're doing everything that they can to improve a lot of things that we experience in healthcare, namely the experience, the access, and of course, the outcomes for healthcare. And that's really why I'm excited today to have our guests on the show. We have David Pascal, who's the CEO of Intrax. We also have the Senior VP of Sales and Client Engagement at Intrax. Her name's Stephanie Haywood. And today we're going to talk about a lot of different things. And we're going to let the experts bring the education, the engagement, the inspiration to you, our community. And so I'd like to welcome our guests. Stephanie, David, welcome to Highway to Health.
Thanks for having us, David.
Excited to be here.
Well, we're excited to have you. And this podcast has been almost like a guilty pleasure of mine because, you know, we get caught on these conversations, these Zoom calls all the time. We really don't have a chance to slow down and learn from each other. And so this podcast is meant to be able to, you know, for me personally, to learn from experts like yourselves, but also to scale that education to anybody that wants to tune in. And we kind of have a little bit of a tradition here. Before we get into the business, I like to ask our experts, our executives, to share a healthy habit that you've implemented into your day. So, David, if you don't mind, share with us how you stay physically, mentally healthy for your family, the company, the community.
Yeah, and it's an interesting question. You know, for me, it's physical activity. And it doesn't have to be exercise. You know, it is getting out, going on a walk, doing something to get your heart rate up every day. I have learned over time that not to shortcut, you know, yourself, you know, when you're doing that. It to me personally, it keeps me alert. It makes me a lot happier of a person. So even when there are those, you know, deadlines looming, don't shortcut it. Get out there and do it.
I agree with you. Oftentimes we'll have something that happens that kind of wakes us up, tells us, hey, you've neglected yourself and your health for too long. And if we can avoid those things and build a habit, build a routine that keeps us, keeps our health maintained, that's even better. Stephanie, you have anything you'd like to share?
Yeah, I mean, I think definitely physical activity is something for sure. I try to get out every day and take a walk or exercise, go to the gym, but something else, I think it's mindfulness too. Just taking that step back for a second and being able to walk away from your computer or walk away from your phone and just spend some time thinking. So mindfulness is a super important part of my day and just having the ability to give myself a moment of pause.
Yeah, that's really well said. Somebody told me it's been about a year ago when I was just really busy and I felt like I didn't have time, right, to do something that I should be doing. And they said the urgent steals from the important. And just because something is urgent, we can't neglect what might be even more important. Even if that thing that's really important doesn't have a necessary deadline, it's still important. And don't let the urgency of a task steal from what's truly important. And so I think both of your answers follow that guidance. And I love hearing from people like yourselves because you're as busy as they come. You're executives, you're running a company, you're running teams. But it's our obligation, it's our responsibility to be at the top of our game for the people who depend on us personally and professionally. And a lot of that has to do with being mindful and physically healthy, so that we can be at the top of our game when they need us. So thank you for sharing that. Sometimes it's a personal question, and I appreciate you guys.
David, I'll add, Stephanie and I travel around the country, you know, visiting different healthcare professionals or speaking. And sometimes on a road trip, she'll invite me to be outside of the car to walk so I can get my physical exercise and she can get her mindfulness.
Oh, that's good. Get away from me. I need some mindfulness time.
Very true. Very true.
It's dual benefit. You're recognizing value right away, right there. All right. I love it. Let's get into Intrax a little bit. For those that are unaware, contract lifecycle management, and maybe before we dig in too far, who wants to give maybe just the 30,000 foot view of Intrax and the way you partner with your customers?
I'm happy to. So Intrax is a contract lifecycle management solution. We partner with hospitals and healthcare organizations all across the country, from small, standalone critical rural access facilities, FQHC, private equity-backed healthcare organizations, all the way to national organizations with presence across the country. It's really our approach to partnership is really strategic alignment on your contract management and compliance and cost saving goals. So, while we are a SaaS-based technology solution, we really feel like it's important to go a step further and create a partnership with our organizations. We understand that your focus is largely, oftentimes, not on the administrative side, right? It's providing care to those in your communities, and having been in the space for, gosh, do I say it, 20 years, we recognize that and the importance of that.
My introduction to this podcast, the whole theme of this podcast is exactly what you just talked about. There's great technologies. The last 10, 15 years has been this golden age of innovation in healthcare. And the common theme, the common goal seems to be, which I'm excited about and want to celebrate, is the idea of getting these healthcare providers back to doing what they got into the industry to do, which is take care of the community and the patients and to deliver the kind of care that they're excited to deliver. And I want to get into how Intrax is bridging that gap. But maybe before we do that, let's talk about, some of the biggest challenges that you guys are seeing when working so closely with these partners of yours. Share with us some of the main challenges that these systems are facing, and how does Intrax maybe help address those issues and bridge that gap?
Yeah, and I'll just start. It's always been important for contract lifecycle management. It's always been a need, organization, efficiency. I think it's never been as important as it is, right now, especially with the cost pressures that we're seeing in healthcare. We see specific, lately it's been labor, but we continue to see those cost pressures there. When we're talking to healthcare executives, that's on the top of their mind. They're trying to figure out a way to not only get past the next 3 months, but build, long term. And it's always hard to think longer term, and there is a tendency sometimes to cost cut your way out of these things. And these systems need to do what they need to do. But what we continue to push in the space is, while you are looking short term, you have to be looking long as well and invest in efficiency. And that is, whether you are setting up a CLM system to catch, costs that may be flying out the door, whether you have contracts that are expiring or have expired that you're still paying on, which we see all the time, or you're taking that next step into building in efficiencies. Can you get contracts done quicker? Do you need the amount of resources to be able to solve your organizational needs? And to me, that's the big thing that we keep touching on right now. Compliance is always a huge piece. Organization is always a huge piece, but that's been a big one lately that we've been solving.
Yeah, I think oftentimes when you're talking about the pressures within a healthcare organization, you're always going to be focused on your clinical applications, right? So then you turn to shortcutting your technology and your IT applications, and you don't realize sometimes the value that those are providing to those cost saving measures, to those efficiencies that really allow you to do more. So I think one of the biggest challenges that we've been having, like David mentioned, in talking to executives, is don't shortcut yourself, right, on the technologies that are really going to add advancements to your health system. They're going to allow you to do more with less when you are in those cost saving measures.
And so when these organizations have a better handle on the contracts that they own and manage, it almost provides transparency in a way where they can understand the tech stack that they have access to, the value that they're getting out of it. And then, David, to your point, they can decide, urgent versus important when they're cost cutting and when they're trying to do these things because of the pressure that they're under. Mm-hmm. They have insight into, the current state of their organization, the current stack that they own, and make better, more informed decisions on the path forward down the road. I've got a question about just, I mentioned this golden age of innovation that we're in, and hospitals, health systems are starting to leverage more technology than they have in the past. And it's a lot of it's due to the pressures that they're under, whether it's staffing shortages or other things that they have to become more efficient and scale their operations through. They're leaning more heavily on technology. Are you seeing some of the challenges that you're helping these providers work through? Are you seeing those challenges tied to just the sheer volume of contracts that they have to own and manage?
I mean, I think that certainly there is a challenge around getting your arms around what the volume of your contracts within the organization. And to your point, bringing transparency and visibility into those. But I think something else is making sure that you're leveraging your contract management solution to help address those challenges, those resource inefficiencies in some instances. I'll use an example. I'm going to take us back to 2020 when we saw the pandemic. And I like to use this example because I think that was really a time when organizations had to look at the technologies that they had so that they could continue to efficiently serve their patients when they were going through a pandemic. Obviously, all eyes were on, clinical resources and making sure that we were addressing those. But we saw clients turning to their CLM to say, okay, it's giving us visibility. We know what we've got on contract. We know how to quickly execute to get the, PPE in that we need. We know that we need these contracts executed quickly, using electronic signature. And so we saw a significant shift in, while you've kind of got all your eyes over on making sure that you're addressing the challenges around the pandemic, using their CLM technology to address a lot of those kind of things that day-to-day businesses still had to get done.
Yeah, that's a good point.
Yeah, you almost see an expansion. Mm-hmm. I love that, Stephanie. Kind of an expansion of what CLM is being used for. Early on, again, I'll say the 20 year, we've been doing this a while, but it was all about where are your contracts, who's responsible for them, what are the dates, in there, and can we get to them quickly? Mm-hmm. And all of that is still incredibly important. But what in many cases, for those systems that are ready to take that next step, it's, can we build our policies in? Signatory policy. Can we start looking at some financial terms that we will keep with before they're negotiated? Mm-hmm. Can we make better business decisions with the data? How can we get that and put it into a manageable usage? And of course, workflow, faster, more efficient, but still keeping that same quality. I think that's a big piece.
I think what we've seen over the past couple of years is the innovation has only increased, right? And that technology has only been used more and more throughout organizations as a means to addressing their ongoing challenges, even if they're not having financial challenges or resource challenges. They're seeing that technology can really add a significant amount of value.
I want to stay on this innovation topic. I've heard you guys talk about how not too long ago you would go in and do an assessment on the current processes that an organization has, and you ask them about the signatory process, and they show you a cart that they wheel around from desk to desk to get. You probably still experience some things like that. Not everybody has moved past those old processes, but we've probably are encountering a more savvy organization, more savvy user, which means Intrax has to keep up with that pace of innovation. And give us some insight into, you guys are leaders of your organization. How are you fostering that innovative mindset there at Intrax? And how do you keep your team motivated? You've got a proven solution. It'd be easy to rest on that proven solution. How do you keep your team motivated to continually innovate?
This is one of my favorite topics. So, for us, for Intrax, we like to look at the mission first. We look at healthcare. We look at, and you said it first, David. I mean, the focus of us is to take care of these issues so healthcare organizations can focus on the patient. And that is our creed. That's our mission. That's where we're going at. That's a lot of the motivation behind Intrax employees and what we're driving to. But innovation itself can come in so many different forms and come from so many different places. So, when we look at innovation, of course, features, maybe it's a product idea, maybe it's a way to get the end user to a destination quicker or more effectively. But also, innovation could also come from a service process that allows for one of our client services representatives to assist a client quicker, to implement faster, to share more information and go through what will this workflow process be. So we like to take the stance at Intrax that every single department is their own garage startup. We're not just listening to ideas. I mean, we're expecting ideas. We're expecting. I started out abstracting contracts in this space. Reading through contracts, pulling out data. And I know, the efficiencies that you can put in just from there to get that data more accurate, to get it faster. And I think when you look at every single department across Intrax, that's what we see. It's better at every level is the expectation.
Yeah, I think that, you said it best, David, and that's an important cultural piece. One of the things that I love about each of our departments and the ideas that they bring is, while not all of them are always, client facing, they are all interacting at some level with our software or with our client base. So they see it and they have the opportunity to bring just kind of a different perspective that ultimately, they can collaborate across their individual teams, but then we really encourage that cross collaboration across teams. So we might have someone that's in implementation that's talking about a feature or something that one of their clients is doing. And, they'll have that discussion with our product team and with our sales team about how we can, talk to our client about that need and better understanding it. So it's really important that, like David mentioned, everybody's kind of a garage startup, but we also talk about how to collaborate across teams to bring the best products and solutions to our client base.
Yeah, well said. I mean, so many things popping in my head. Salesforce is this 50,000 person or employee company. They're 35 billion in annual revenue, the leading CRM. But if you ask the leadership team at Salesforce about their culture, they want it to be a 50,000 person startup. They want everybody to be a part of the innovation. They want every voice heard because every voice has a different perspective and experience with the platform and probably have an idea or two that could be leveraged. And that innovation is, and you said it, you guys said it too, is solely meant for, the improved experience for the customer, the improved experience and outcomes for the customer. And when you're customer centric, that every innovation that you encounter and implement is providing direct value back to the people who depend on you. And I think that's really powerful stuff. And what I'm hearing from you is what I've heard and experienced from, the other leading and best companies in B2B. And that's exciting. That's powerful to hear. And I'm sure your customers provide very great feedback on that level of innovation resulting in delivering the value that they expect.
For sure. And, I'll just add, we're healthcare specific, which is really great because we understand the unique complexities of contract lifecycle management in this space. I mentioned, David and I have been doing this for 20 years. Our executive team has been doing it for, an average tenure of 20-ish years. Most of our team members have spent their careers in healthcare CLM. And I mention that because it's important, because when you bring those innovative ideas, you really have a true understanding of the path that our client partners are on, right? So we're bringing ideas that are going to be beneficial to healthcare CLM, not these kind of crazy out of the box, let's go down this rabbit trail of something that's not going to really add value. We're really focused on, we have a colleague that says, focus till it hurts, essentially. And it's kind of a motto at Intrax because we're focused on making sure that we're providing that value healthcare specifically to the market.
So how do you gather some of that customer feedback and get that insight from the end user and your partners so that you can use that feedback to foster that and motivate that innovative personality and culture that you have at Intrax? Maybe share a story of a piece of feedback that has shaped a service that you're now providing.
Well, I think we get it from all sorts of ways. Obviously, we're incredibly engaged with our client partners. So our team is interacting with them consistently, whether that's on our support desk or, our account management, client engagement team, our implementation team. So we're constantly seeking and asking for feedback. I got an email the other day about, we were working on kind of solving a challenge that an organization was having, like an internal process organization. And we brought, a couple of ideas and we said, here are the pros and cons of each. So we weren't just kind of like forcing something down their throat. We were saying, you can do it this way, or you can take option B. And here are the pros and cons of each. And the response back was, we really appreciate you bringing us options and guiding us into what you recommend as the best practice, but giving us some autonomy to kind of determine what's going to be best for our organization. And that helps continue to show that, we made the right selection and partnership with Intrax, because you're not just saying this is how you have to do it. We want to provide guidance and best practice, but at the end of the day, it's their organization too. So we have to be mindful of that. So, I think that's just one story or example of how we get that feedback and the partnerships that we have. But David can speak specifically to kind of that executive feedback that we get with our NAC.
Sure. And before I go there, just one other thing to add on, Stephanie, trust. I think trust is a huge thing when you're looking at not only customer feedback, but solving problems. And necessity drives most innovation. That innovation could also be problem solving. And it doesn't have to be this solution focused. It doesn't have to be software focused. But to have the kind of that back and forth trust from your client service side and the end user, the customer, I think it goes a long way to have a service group that it doesn't even have to be CLM related. How can we solve your problem? And how can we brainstorm to really get here? That also drives ideas of what could be and where we should go. So I think that's a really big piece of client services. And I think that's manifested in the Intrax Advisory Council. So the NAC, as we like to call it, it's a group of healthcare professionals. And it is a fantastic group. They are driving a lot of where we're going. We have a lot of fun together. And to me, that is, somewhat of a microcosm of client service, asking questions, understanding what the needs are, what tweaks can be made to make life better, make it more efficient, or what are the big things that we should be tackling in healthcare? What is going to make the biggest, difference in the space? And, many times folks think of a new product or something like that. A lot of times it's just a tweak. It's, could we be using the same solution to solve an additional problem? problem. So I think looking at it kind of holistically from an executive side, but also, I mean, just the end user, it's almost the same approach.
Your answer actually reminds me a lot of Jesse Cole, who's the owner of the Savannah Bananas. I don't know if you are familiar. Are you familiar with
the Savannah Bananas?
Okay. The way he thinks about fan or customer experience is very similar to how you described it. First of all, you have to know what their pain points are. And then innovation doesn't always look like a new shiny piece of technology or automation. Sometimes, like for the Savannah Bananas, it's as simple as saying, look, instead of charging them $7 for a ticket and then $10 for a soda, we're going to charge them a $10 ticket and it's unlimited sodas. Mm-hmm. And it takes that friction point off of the ticket holder to say, okay, now I'm going to have to budget for this many sodas and now my cost of ownership is this much. No, innovation to him is like, let's make this easy for everybody. $10 tickets, a little more than what you've spent in the past. You're going to save some money in the long run, and you're not going to worry about your kids asking for an extra soda or an extra hot dog because it's all included. And his view of innovation, to your point, is very similar to what you say. Get the feedback and then take the friction away the easiest way possible for your customers. And when you do that, those customers become fans. And according to Jesse Cole, those fans will do the marketing for you through word of mouth. And that's how innovation can really drive a business and growth for an organization. And you guys, I mentioned Salesforce earlier. I mentioned Savannah Bananas. Now, I don't know if you can get more opposite on the ends of the spectrum, but what I'm hearing from you guys is what I'm hearing from some of my favorite brands.
Yeah, I think it goes back to the, like we were talking about, the having a partnership, having a relationship with those organizations, engaging with them all the time, and then really our culture of innovation and making sure that our team members feel comfortable bringing those ideas to the table, whether it's a tweak or a, whole new product. We don't look at them and say, that's a terrible idea. We explore it. And that's how you build a business. It's how you grow a client base.
We've talked about, kind of where we came from, where we are. Let's look at, this is called Highway to Health. Let's look down the road. If we're on this journey together, let's look down the road and look at some future trends that you might see emerging. If you could predict maybe what might have some of the most significant impact on the contract lifecycle management's process in the healthcare setting, what do you see coming down the road? What's in the near future and beyond?
Yeah, another one we love to talk about. We talked earlier about organization, transparency, moving to workflow and efficiency. To me, it's the future is automation of a lot of those ideas, and in many cases the same value concepts that were before, but just built in to a solution. And being healthcare specific is so important to us because we're solving specific healthcare problems in CLM many times. And when I say automation, it could be understanding clause language as it currently sits in your system, or as you're negotiating it and you're building contracts. So is this something that we hold standard across all of our organizations, compliance focused? Can we make sure that when we're moving forward in these arrangements that we're thinking compliance, we're also thinking business decisions at the same time, and we have that information. AI is a huge piece of that as well. Being able to assist in some of those decisions and setting them up beforehand, pulling data out of machine learning, being able to pull data out automatically and have that information to, again, where you can make better business decisions, or it driving or triggering different folks to look at it in many cases. Because that's another piece. You have transparency, but are the right folks responsible and opining on many of the decisions that we do?
The AI topic, everybody that I talk to that, is really entrenched in the application or the implementation of artificial intelligence in healthcare talks about the need for large data sets to train that AI to be as smart as you need it to be on the topics, the specific topics that you're working in. We don't seem to have a challenge in the amount of data that we have in healthcare, especially in your world, to train those AI models. It may take some time, but I see a huge potential in that space, especially with CLM.
Yeah, I mean, I think you hit the nail on the head when you talk about the data sets and the amount of data, and the training of the AI, right? So it's, especially in healthcare, it's pretty unique. The information that's in the contracts, the information that you're trying to make sure that you're getting visibility into, whether that's on the clinical or the administrative side. So AI is absolutely an important innovation, and it's going to be key. It is key, and it's going to continue to be key in CLM process. But that's also not to say that it's a magic bullet and going to, address every issue. So I think that, when we talk about, and we have this conversation all the time with our partners and internally, right? Like, what's the right level of AI to make sure that at least Intrax is putting out the appropriate, like making sure you're getting value out of it, right? Because we know that it's going to take a bit of time. So what are like iterative steps that can be put in place to make sure that you're addressing those things? And it's definitely going to be transformative. And it already is. We can see that. We're excited about the future state of AI as well. But that's not to say that you should neglect processes, your contracting processes, the automation that you can build into your CLM, and take advantage of that in partnership with use of AI.
No, that's great, Stephanie. One other thing, just to piggyback, when we look at, the next thing in the future, we love substance over flash. Are they common sense solutions? They may revolutionize the space, but they're substantive, and when we look at it, they need to meet the need and not be something that sits out and, you ooh and ah over when you talk about, but doesn't really work on the other side. So, and we take that same approach with AI. It needs to solve the problem at hand, not just kind of look cool over here on, on the side.
Yeah, there's real world application right now for AI, but we're just scratching the surface of where we'll be in the future. It's just going to take some time to get there, like it always does, but that's okay. And you're right. The substance to a solution right now is where the value can be had for our partners. This is, we talked about your healthy habits at the beginning. Hopefully that inspires others to carve out some time in their day to maintain, the importance of their health. I'd like to kind of start wrapping up here with another piece of, inspiration for the listeners. I'd like to ask each one of you on the best piece of advice, professional or personal advice that you've ever gotten, and how has that impacted your strategy at Intrax?
I've probably gotten a lot of advice over the years, probably some that I should have heeded better, for sure. So I would say that one of the best pieces of advice that I ever got, especially as I was starting my career, right, was, be bold. Don't be afraid to speak your mind constructively, right? But, be true to the person that you are and bring that person to work with you every single day. And, don't shy away from speaking up when you have an idea, or speaking up when, hopefully everything that you're doing is fundamentally right. But if you feel like it's not, not being afraid to speak up and just kind of being bold and being true to who you are is really probably the best piece of advice that I received early on in my career. And I've really tried to take that into my career. And I think it's hopefully put me on a path, and at least a path with companies that I've enjoyed working with.
Well, and those companies benefit from, bold strategies and bold advice. So it's good for you. It's good for those around you too. Mm-hmm. David, what about you?
And Stephanie and I did not, talk about this before, but I guess I'll do too now, because mine was be bold.
Oh gosh,
that's we have the same one. But I think additionally, some great advice that I received early on was meet people where they are, and understand, have enough emotional intelligence to understand where people are, how they're feeling, how they're fitting in the team, the value that they're getting, what motivates all of us, and that could be internal to Intrax, it could be client facing, it could be family and friends, but to try to meet people where you are and at least try to understand, and it's all about people and not you driving to go get somewhere.
I like both of those. One that ties in with that I've gotten recently is it's not about you, and the sooner you figure that out, the more you'll be able to help others. And when you do help others, it'll come back, in multiples. And so taking yourself out of it, understanding where that other party is in that moment, and focusing on how you can meet them where they are, I think those go hand in hand. And so I appreciate you sharing those things. All right, last question. And we've talked for about 30 minutes here. People are going to walk away understanding more about CLM, how it applies to healthcare, where they can start finding value, what's coming next. If they could walk away understanding one thing, how would you sum it up? They're walking away from this podcast and you want them to walk away with one thing on their mind. Well, how would you sum it up for them?
I think my answer will be CLM focused, but also you could relate it to a lot of life situations that you may be dealing with. But to me, it's take the first step. Wherever you are, we talked about the wide evolution of CLM. There are different healthcare organizations in different spaces, in different, areas as far as CLM, whether it's taking that first step to get your contracts in a system where you can see them and kind of understand and have that transparency, or if you're working on sophisticated workflow that it's going to reduce your days in contracting. Take that first step, understand where you'd like to go. You don't have to boil the ocean, but what's the first step that you want to take to get better for your organization? And again, same thing in life. We always want to try and set these large goals. In many cases, it's best to break those down into steps that you can take, and then just focus on the first one and get there.
Yeah, I don't know that I'd have anything else to add. I think it's well said and important to just kind of like think about things. Accomplishments don't happen all of a sudden. It takes time. It takes a lot of hard work. One of the things that I actually thought, David, instead of saying be bold, you would say something about grit, because, you always talk about making sure that, you have grit. And I mean, I think that's really important. And that's what I would leave our listeners with, have a strategy, take it step by step. Don't be scared to step outside the box and do what you think is best for you.
What I've enjoyed about our conversation and listening to conversations that you guys have had elsewhere is you're realists. You don't claim that everything's going to be perfect and it's going to go, perfectly smooth and everything's going to be ideal in everything. There's going to be bumps along the way. There's going to be tough choices to be made. And from everybody that I've listened to and talked to at Intrax, you guys recognize that. You prepare your community for it, and through grit, boldness, and strategy, you're able to overcome it together. And I appreciate you sharing a little bit about the company, the industry, and inspiring our listeners along the way. So y'all are welcome back anytime. I really enjoyed this.
Thank you.
Really appreciate it, David. Thanks for having us.
All right, thank y'all.